Hey guys, it's Dr. Tom with EBM Fitness Solutions, and in this video we're going to go over just some general guidelines if you are rehabbing an injury. And this is true for something that is post-surgery, or if you're dealing with something that is more of a chronic issue that may kind of come and go and seems to flare without any real reason. Rehabbing any injury for any reason is a complex, complicated process. I recommend that you do not do it by yourself. If you're coming out of a surgery, there's going to be swelling, there's going to be inflammation, there's going to be a lot of difficulty you may have moving around in general. It doesn't matter whether it's an upper body or lower body injury. With these other factors, the swelling and the inflammation, the pain, there's also apprehension. There's fear of injury again. So how you move changes. It changes because of physical limitations or because of psychological ones, because you don't want to move because you're afraid it's going to hurt again, which makes a lot of sense. But we have to make sure that we navigate this properly, right? Practice becomes permanent, as the saying goes. How you move, which is essentially how you're practicing, becomes how your body will move just intuitively. If you allow bad habits to develop during rehab, they will persist once your pain is gone and once you're done rehabbing. It's a classic example of somebody who limps because they have pain, and then once the pain is gone, that person still limps unless they spend time correcting that part of it. If they don't change how they walk and actually work on the mechanics, that will linger as long as the person lets it linger. So having somebody to kind of guide you through that process is incredibly important so that you don't essentially correct one thing and create one or two additional problems from trying to rehab the original injury. Another reason for having somebody oversee the program is when following the home exercise program that is often prescribed after a surgery, your body will compensate. It follows the path of least resistance. I see this a lot. I see a lot of post-op patients where I am currently at EBM Fitness Solutions. I saw a lot more when I was at the hospital doing physical therapy there. And patients or clients would come in with a home exercise program or things they should be working on, and when they demonstrated the movements, you could see that the movement was not being done properly, but the person thought they were doing it right, and this is part of the problem. It might be a subtle shifting to one side when doing a squat. Even if you're holding on to the sink or holding on to something at the gym, if you're coming down and drifting towards one side because of avoiding pain or just because that feels natural, that's problematic. We have to address those things early on in the rehab. Otherwise, it's actually going to delay your ability to get back to where you were prior to the injury. In this case, kind of get back to where you were before the pain that led you in to have the surgery. Chronic injuries are a different story. These have often been in the works for a long time. In most cases, we're talking years. In some cases, decades. So basically what happens is over time, and maybe this started from an injury way back when, but nonetheless, there's always a movement component to these chronic injuries. That's just how it works. So there's something, whether it's a tight joint or tight joints, weakness, some kind of poor stability in certain parts of the body, and it may be a combination of all these things. But chronic issues tend to present a little bit differently than, say, post-op or post-surgery situations do. With these, we have to address all impairments and try to deal with them all at the same time, but understanding that they are typically movement-based. Now, you might have tightness in your calf muscles, and maybe your ankle joint doesn't move well. Maybe the IT band is locked up and needs to be addressed. Maybe there are some postural issues that we have to also address, but those things all need to be tackled at the same time. Oftentimes, there's an order you want to do them in, and this all starts with proper assessment. But understand that you have to change not just what you do with your exercise, but your daily activities. The daily activities add up to a significant amount of volume. If you look at all the steps you take, the stairs you climb, the number of times you sit and stand, all these things will add up over the course of the day. So if you're doing exercises, 20 minutes, maybe an hour a day, or you're at the gym, but you don't address all those other daily activities, the exercise can't compete with that. They can't compete with the volume. You have to change how you move in general. And part of that starts with making you aware of how you're moving. And that's where a good assessment can point things out that maybe you didn't even realize you were doing. And then you start to pay attention to those things throughout the day. You start to make those changes. And then you reinforce it with your exercise program, and you allow those two things to work together. That's the key to not only managing the issue in the short term, but actually reaching a point of resolution in the long run. Something else to keep in mind as you move through the rehab or the recovery process is the idea of layers. Ogres have layers. Onions have layers. So as you basically solve one problem, you oftentimes expose another. So as you improve your walking mechanics, say you have a lower body injury, you improve your walking mechanics through a number of things, and that resolves, you move into more complex, more dynamic activities that you were avoiding. Now you're starting to find that you don't rotate as well. And instead of rotating, you're not rotating through the hip as well, so you're starting to irritate your knee. So basically by working through to one point, or instead of removing one layer, we expose something new. And this happens a lot. So basically the person thinks, oh, I've done this, I'm good to go, when in fact all they've done is open themselves up to actually the increased risk of other injuries because they're doing more challenging things now, things that they avoided before the injury. They're coming back and they think, no, I'm good, I don't have to worry about this anymore. But having that guidance, having somebody to watch over what you're doing to correct those things as they happen will save you a lot of trouble in the long run. If you overlook these things, again, you end up rehabbing one thing and coming out of it with one or two new injuries that you now have to deal with. And that really defeats the whole purpose of the process. The idea is if you're going to have a surgery or if you're dealing with resolving some sort of a chronic issue, that as you move towards the end of that process, you should feel better, not worse and more banged up than when you started. When you approach your home exercise program or working out in the gym or anything like that, you want to change your approach to sets and reps. I've talked a lot about this before in different formats, the idea of kind of inverting your rep scheme. A common rep pattern is 3 sets of 10. People go in, do their 10, rest, so on and so on. With rehabbing injuries and improving motor control and things like that, sometimes inverting that and making it 10 sets of 3 or some variation of it. Could be 5 sets of 3 or 6 sets. But the idea is keep your sets brief. It allows you to focus on your technique, allows you to manage fatigue. If you just focus on 1, 2, 3, sometimes 4 reps at a time, I use this strategy all the time when dealing with pain and rehabbing injuries for people. They can focus on 2 reps at a time. Have them do 10 in a row, different story. Subtle things will shift in the ability to control joint positions, the ability to hold the body position, to keep the right muscles active. But for 2 reps, they're good, right? Sometimes what you want to do is almost break up your set into mini sets of 1 rep. Do a rep, reset all the little pieces that go into setting up that exercise. If you're doing a lunge, for example, make sure that each time you come back to the start position, you get your foot in the right position, you actively think and focus on the right muscles, your upper body's in the right position, but do them 1 at a time. And to kind of dovetail that, think about doing 1 less, not 1 more. Right? So a lot of times when we exercise, you get to that juncture in the set where you pause and you're getting all geared up for that 1 last rep. When you're rehabbing an injury, 1 less is better than 1 more. So if you get to that point where you're starting to feel like, well, maybe I could do another one, nope, you're good, done, cap it, move on to the next thing. That 1 extra rep is not going to make or break your rehab in a good way, but it could set you backwards a little bit. If you lose balance or lose technique or move a certain way, you can absolutely flare things up towards the end of your set, especially as the muscles fatigue. You may not feel fatigued, but the muscles may start to fatigue, which means they don't stabilize the joint the right way, or they don't initiate the movement in the right way, and that can feed into some inflammation, some irritation, and all that does is delay you getting better, and you're trying to get better quicker. Everybody wants to be better yesterday, and I get that. So you have to take the right approach to allow the body to heal. Sometimes our job is to get out of the way, right? We can't always accelerate the process, but we can slow it down, and a lot of people are very good at slowing it down. So get out of the way, let the body heal, and do what you can to facilitate things, but try not to overdo it and understand when to do a little bit less. That 1 less, not 1 more idea is great if you couple that with inverting the rep scheme and keeping your sets and reps. Well, you can do more sets, keep the reps brief, and repeat as many as you need to get the job done. And it might be, don't be afraid to do 3 sets of 3 reps for an exercise. Nothing wrong with that. If you can go through pain-free range of motion, there's no increased pain by the end of the set, and you complete all 3 sets of those 3 reps, then you're moving in the right direction. Versus doing 3 sets of 10, having your range of motion decrease slowly and have your pain increase as you move through that, that defeats the whole purpose of what you're trying to do. So focus on some of those things. If you need any help, reach out via ebmfitnesssolutions.com, info@ebmfitnesssolutions.com, or Facebook, Instagram. I'm all over the place. We'll talk to you guys soon.